Dr. Kathie Allen, Democratic candidate for Utah's 3rd Congressional District. Thank you so much for being part of 3 Questions.
Well, thank you for inviting me.
Tell us, why are you running for Congress?
I'm running for Congress because I want to instill integrity back into the government. I respect truth, and I mean that in 2 ways. I mean that in terms of ethics, and I mean that in terms of science. I'm a science-driven person, and I am pretty horrified by what the current administration is doing to undermine scientific truth and data.
Be specific for us, if you would. What is it that you are most concerned about the current administration?
They don't tell the truth. How can you solve policy decisions if you base them on false information? And I don't feel that there's any trust of the American people toward the administration. I think that there's been undermining of democracy. I mean, you're in the press, you know that he's attacked the press, and I'm really disturbed by all of the false news out there. And I understand that we have a First Amendment, but it doesn't seem to come with an owner's manual. And I think we need to start being responsible as individual citizens to try to sort out what is false news from what is actual fact, and care.
If you get elected as a freshman congresswoman, what is it that you can do to correct the problems that you see in not only Congress but in the Trump administration?
I think the first thing that you do, and it's something that I've learned from being a physician, is you listen carefully to all arguments so that you can understand them yourself, and so that the person who may be on an opposite position to you understands that they have been heard. I think that's very important. Am I going to change the world in 2017? No, I don't think that's going to happen, but I can. One thing that I've pledged to do is be on a brand new caucus in Congress called the Problem Solvers Caucus. It's got about an equal number of Democrats and Republicans, and I want to break the groupthink, and I will be in that caucus to see if we can discuss health care in a bipartisan manner.
In your view, is Congress providing enough oversight of the executive branch?
Absolutely not.
What would you like to see happen?
I'd like to see Donald Trump's tax returns. I'm appalled that the GOP voted that down the other day. I don't understand why. I want to have an exploration of the conflicts of interest and the possible violation of the Emoluments Clause. And I want this Russian thing to accelerate. It's the sort of thing that causes anxiety for Americans. I go to sleep and I wake up every morning and I think about our government. You know, 8 or 9 months ago, I never did that. I thought about what I was going to do on my day off.
What is it that made you decide that you wanted to run for Congress?
Well, I think it was several things, but the ethics was the first argument. It was the fact that I viewed Donald Trump as somebody I could not trust. And I saw the virulence with which Jason Chaffetz went after Hillary Clinton. And I started to write letters to Jason Chaffetz asking him to investigate the business conflicts of interest of Donald Trump. I had petitions signed. I had an op-ed that the Tribune printed, and it had 202 signatures on it. I've never seen him do that before, but we all were asking for Jason Chaffetz, as chair of the Government Oversight Committee, to investigate Trump with the same vigor that he had investigated Hillary Clinton, and he just never would. And then I went to his town hall, and that kind of cinched things for me.
What happened there that cinched things for you?
I remembered being a congressional aide. It was my first job when I got out of college. I worked for an actual Republican congresswoman in California. And yes, it was before the age of the internet and life was a little simpler, but we answered all of our letters, we answered all of our phone calls, we cared what our patients thought. And as I sat there listening to him deflect every single question and accuse us of being paid protesters, I just began to think, he is a poor public servant and I could do better.
You are a medical doctor, a family practice physician. You've treated people of all ethnicities and all income levels. What in your professional life or personal life has prepared you to represent Utahns in Congress?
I think that the skills of a family physician relate directly, and I'll explain that. If you think about your favorite doctor that you've ever had, what were the characteristics of that person? Presumably they listened to you, they did not jump to a diagnosis prematurely, and after they had taken a thorough history and physical, they used their analytical skills to arrive at a provisional diagnosis, and then they made a treatment plan. Now, when I think of a relationship between a representative and their constituents, I think there's some real overlap there. There should be clear communication, there should be a sense of partnership, there should be trust and honesty. And so I think that being a physician is an excellent preparation for being a representative.
What do you see as the most pressing issue for Utahns that you can do for them in Congress?
It's health care. I mean, we've done surveys on that. When my volunteer team calls people on the phone every single day, we give them surveys of what they're concerned about. And we usually list 4 things, and healthcare almost always wins. That is what keeps people awake at night, the fear that things like pre-existing conditions will come back. It turns out that 49% of people in the 3rd Congressional District have a pre-existing condition. The Medicaid issue that was presented over the summer by the GOP, striking 20 million people off of the Medicaid rolls, that hits Utah very hard because we have a lot of people on Medicaid, we have a lot of young families, and there's a fear of losing one's health care completely or reverting to what we had before the ACA with the pre-existing conditions and the prices continuing to rise, because it really appears that the Trump administration is trying to undermine the ACA. Even though Congress failed to repeal and replace it, he has stripped the advertising budget for it so that it will be harder to know when the open enrollment period is. And he has also refused to come out and say he's going to support the subsidies. So all of this is destabilizing the insurance market. And Molina left, and now we're down to just 2. So I think that is what is on the minds of our constituents.
As a medical doctor, you have been on the front lines of medicine and in the trenches for most of your adult life. Politicians on both sides of the aisle agree that Obamacare needs to be fixed.
Yes.
In your view, ideally, what does a healthcare system that works in this country look like?
Well, it has at its top the patient-doctor relationship that should be sacred. I actually had the opportunity to ask Nancy Pelosi at a public event when the ACA was being rolled out if she was going to do something to make sure that patients could keep their doctors. And she assured me, yeah. Well, it didn't happen, and it's one of the weaknesses of the ACA. And there's lots of weaknesses in it, to be honest. It's got too many regulations for doctors. It doesn't cover everyone. It's not affordable. But if you look at the rate of raise of insurance before the ACA, even though people complain about how high the premiums are. If you look at graphs, the rate of acceleration of how expensive premiums are actually did slow down with the ACA. So I wish they had had the public option that they were considering 8 years ago, because if they did, we would have data. We would have data to show what's cost effective and what isn't.
So, in your view, can the ACA be fixed, or should it be scrapped altogether and bring in something new?
In my view, I would like to see a universal health care for everyone. I do believe that health care is a human right, and I can cite our founding documents if you want for where I derive that impression. But because it's going to take a while to get everyone covered, I would like to see some changes in it. I'd like to see, for instance, the government be able to negotiate with pharmaceuticals to lower the cost of pharmaceuticals. I would like to see generics brought to market much sooner than they are. I think it's just criminal that people who are diabetics still have hardly any generic choices among the insulin family. It's been 40 years. They've reaped the profits. Now let's make it affordable for this epidemic of diabetes that we have in this country.
So can Obamacare be fixed, or should it be scrapped?
I think it can be fixed, yes. I think that we need to make clear that the subsidies are going to be honored. I do think that we need to reinstitute the individual mandate, and I know it's unpopular, but certain states have tried all the other things about the ACA, but have gotten rid of the individual mandate, and their programs have gone broke. We simply have to have healthy patients in the pool, just like any other insurance product. You don't put all the bad drivers in their own class and expect it to work. Any insurance products works because of the way it spreads risk. And so, yeah, I think that we have to encourage young, healthy people to be part of it. And we need to ensure the subsidies and that everyone knows. But even where it is right now, with all the uncertainty, every state has at least one insurance company that's still on board with it. So the idea that it's tanking and that it's going down the drain is very overstated.
It's been 20 years since a Democrat held the 3rd Congressional seat in Utah, and Bill Orton was the only Democrat to have held that seat. Your opponent is a very popular mayor of a big city who appeals to a large swath of Republicans. Realistically, what do you think your chances are of winning this election?
Probably better than anybody thinks. I think the fact that I am a physician gives me a gravitas that he didn't have this yesterday morning when I read the article in the Tribune about his socks. To be honest, while he's been talking about socks, I've been giving healthcare town halls because I care to educate the people of the 3rd District about how complex this issue is and to pose solutions. So when we give these healthcare town halls, we've talked about why the free market does not work for healthcare. I have Joe Jarvis that gives that talk. He is a Republican conservative who does not believe in the free market for healthcare. He's another family doc with a master's in public health who's studied it for years. And he has a very compelling slideshow about why it doesn't work. We have also talked about the opioid epidemic. We've talked about medical cannabis. We've talked about special interests and how they keep the cost of healthcare and pharmaceuticals high. So we're going around the district doing these healthcare town halls. We have 5 left, and people can read about them on our website. So I think that because I have actively been campaigning and getting out my message for the last 7 or 8 months, that I do have people that are very loyal supporters now.
Medical marijuana is a hot topic here in Utah. The legislature says there isn't enough medical evidence yet to pass legislation to make it legal here. But on your website, you say the medical evidence is in and it's compelling. The medicine in cannabis can help people with chronic pain and other conditions. Who is right about there being enough medical evidence to legalize medical marijuana here in Utah?
You know what I find with Utah, because I've lived here a very long time, if the legislature just isn't ready to do something, they always say they want to study it more. Well, the studies are out there. You can read them in the medical journals. Medical cannabis is useful for a variety of conditions. Probably the most evidence for its usefulness is in the treatment of chronic pain. And another one is a lot of childhood epilepsy. It's like a miracle drug for some people. Some of the other uses are glaucoma, MS, PTSD, severe anxiety. The uses, we don't know all of them because the fact that it's a Schedule I drug, and that means it's worthless, so nobody studies it from the government. But that doesn't mean that it hasn't been studied by private industry. So the studies are published, they're out there, and here's the thing, no one's died of a marijuana overdose. People die of opioid overdoses. This is one of the things that we talk about all the time, is it's actually safer and probably more effective for someone to try medical cannabis first for their chronic pain problem, because it doesn't have all these drug interactions and it doesn't cause you to die, than it is for physicians to keep prescribing opioids.
As a physician, what do you do personally and professionally to prevent your patients from becoming addicted to opioids?
Well, throughout my whole career, I've been very cautious with it. I wrote an op-ed about my father's addiction. It was in the Deseret News last week, and it's a very visceral story about how his addiction affected my whole life and that of my family. And because I grew up in that kind of a situation, I've always been cautious with these drugs, and to me they're not first choice, they're not first line drugs. And with medical cannabis being legalized, they'd be even further down. I've had employees in my medical office that became addicted and committed felonies, usually against me because they used my name. I've had patients with the problem, and I've had a real struggle with it in my career, but one thing that's beautiful about working at UTA is their tracks drivers and bus operators, and the culture at UTA is such that no one wants to be on them anyway, and I haven't written hardly any of them at all for the last 2 years.
Tell us about your family. You're a wife, a mother, grandmother now. Mm-hmm. Tell us about your family. Let us get to know you just a little.
Okay. I got married rather late after completing all of my medical training, and I met my husband on a blind date. His name is Craig Feinschreiber. He was very well known during his career as the principal percussionist of the Utah Symphony. Music and the arts in general are a big part of our lives. We enjoy the theater, we enjoy music, we enjoy travel, and we're in 2 book clubs. So we read lots of books, or I used to anyway.
Children?
He has 3 children. So by the time I got married, I was nearly 40. I didn't have any of my own. My stepdaughter, when she was about 13 or 14, she had a difficult adolescence and she wanted to live with us. So I had quite a hand in raising her, and she's the one that has the 2 grandkids. And I have a stepson that lives in San Francisco, and another stepdaughter that lives here in Salt Lake, actually in Cottonwood Heights, a potential stepdaughter / constituent.
As a Democrat running for the 3rd Congressional seat in Utah, you have a large mountain to climb. In your view, what is the key to winning this election?
Quit looking at me in a one-dimensional way. Just because I'm a Democrat does not make me not an advocate. It doesn't subtract anything from anything I've told you during this interview. I listen, I analyze, I'm a good problem solver. And if I really look at the values of people who live in the 3rd Congressional District, it seems to me that what they want is somebody who does not act like a xenophobe and want to get rid of immigrants. Most people in Utah support DACA. Most people in Utah support clean air. That means we've got to have some regulations. And most people in Utah want their health care to be efficient and affordable. Who cares if I'm a Democrat? I'm a healer. I just am so frustrated that that is all some people care about. So we got to complain about our ad because I didn't say I was a Democrat. I didn't even realize I had omitted it till somebody brought it to my attention. But honestly, why do people think that that is the most important characteristic of somebody that's going to represent them in Congress? Pick the best candidate. Pick the person who's going to advocate for you. Pick the person who has actually spent a life saving lives.
Dr. Kathie Allen, Democratic candidate for the 3rd Congressional District in Utah. Thank you so much for being part of 3 Questions.
Thanks.